This is Michelle Bruno, and this is my presentation for Telehealth Dietary Program. The Telehealth Nutrition Program is intended for telehealth interventions to supplement the care of adults with diseases that are impacted by diet. Um, the interventions we would use would be phone calls, emails, video, and web-based programs. We would be focusing on the independent living and assisted living facilities and focusing on diseases such as cardiovascular disease, diabetes, end-stage renal disease, and obesity, all which can help to be controlled with diet. Program outcomes we will be looking for are overall improved quality of diet, sodium reduction to help improve blood pressure, increased fruit and vegetable intake daily, weight loss, and we will be looking overall at sustained diet improvement and sodium reduction over longer periods of time. Best practices do show a high rate of improvements in blood pressure, weight loss, and waist circumference. Best practices show this program type to be beneficial in both community and ambulatory settings, patients with diet-related chronic illnesses, and it can be used by healthcare providers, nurses, social workers, nutritionists, and health educators, which we would employ all of those. During program implementation, there are some items that we will need to keep into consideration. HIPAA, the Health Information Portability and Accountability Act, has state regulations that need followed for electronic communications, especially around security. The mission of our organization is to improve the health for adults with nutrition education and support using telehealth, so we want to make sure we're staying focused on that. And our why. Our why would be to improve the health of the residents in the centers using dietary interventions, to increase access to nutrition education. Many don't have transportation to be able to get to doctors or, say, to other educational nutrition centers. Also, there can be users in rural areas that we need to reach out to. And they're also in the comfort and convenience of their own home or living facility. For marketing and planning, we'll want to make sure we stay focused around our mission. We will look for local and rural adult care facilities. We will find community partners to help us grow and to share educational material. Stakeholders, including the community members, the partners, and the organization, will all meet together to make sure they are being successful and meeting goals. We will be applying for grants, both public and private. Public ones are tax supported, such as through the Administration on Aging, and private funding, such as the Robert Wood Johnson Foundation or local community foundations. Adaptations we will be making to the program is we will be focusing on assisted and independent living facilities, as opposed to focusing on all adults in a healthcare organization, which is often organized through the medical group practices. We will also be working with staff at the facilities, which are not actually part of our organization, to include dietary and the nutritionists at the facilities, so we can all work as one to improve the health care for the patient. We'll coordinate care and services offered at the facilities for them.